अस्सलामुअलैकुम, मैं हूं लुबना, आपकी होस्ट। एक बार फिर आपको वेलकम कहती हूं ऑन TVOne। थैंक यू सो मच फॉर वाचिंग संडे ब्रंच फ्रॉम ह्यूस्टन। और सबसे पहले आप लोगों से कहना था रमज़ान मुबारक TVOne की तरफ से एंड ऑफ कोर्स मेरी तरफ से भी। ये बहुत ही बाबरकत महीना है और आप हमारे साथ रहते हैं। थैंक यू सो मच फॉर दैट। और बता दूं, सबसे पहले आगे लेके जाऊं, मैं आपको बताऊं टॉपिक के बारे में, हमारे गेस्ट से भी मिलाऊंगी आपको, लेकिन उससे पहले आप लोगों को बताना था कि काफ़ी आप लोगों की कॉलें आई, काफ़ी कुछ लोग हैरान परेशान थे कि लुबना कहाँ चली गई। Well, I was on vacation with my family, but I am back and I am here to stay. But thank you for missing me. And just like every Sunday, we will have a topic and of course we will have some guests. और सबसे पहले आपको इंट्रोड्यूस करवाती हूँ आज के गेस्ट के साथ। सबसे पहले हमारे साथ हैं मनाज़िर शम्सी MD, founder of Drug Addiction Treatment Center. He has been also involved in treatment and drug addiction and psychiatric patients since 1976 in Houston. Welcome to the show.
Well, thank you, Lubna. It is an honor to be on this program, Sunday Brunch. I should say thank you, shukriya, dhanyawad.
Thank you. And thank you for taking out time from your busy schedule. Thank you so
My
much.
pleasure.
Thank you. और हमारे जो दूसरे गेस्ट हैं वो हैं फ़हीम प्रासला from Prasla Law Firm. Now, Prasla Law Firm is where they handle business litigations to employee and employers disputes. Thank you so much for taking out time from your busy schedule and coming here.
No problem. Thank you so much for having me on.
All right, and we'll talk to you some more too.
Thank you.
और उसके बाद हमारे जो तीसरे गेस्ट हैं वो हैं ज़ुरीस रशीद, Director of Business Development from Atrium Medical Center, a long-term acute care hospital. Welcome to the show.
Thank you. Thank you for having me here. I'm glad to be here, Lubna.
Okay, well, thank you very much. और ज़ाहिर है मैंने आपके जो गेस्ट हैं आज के उनसे मिलाया। आपको नंबर भी यहाँ का मैं दे दूँ, अगर कोई सवाल आप लोगों के पास है इनसे पूछने के लिए। We will direct the calls to them and let them know. यहाँ का नंबर है 855-886-6387 एक्सटेंशन 4। एक्सटेंशन बहुत ही ज़रूरी है। जब तक आप एक्सटेंशन नहीं डालेंगे we won't be able to get your calls to my show. और चलते हैं आज के सवालात के साथ, आज की बातों के साथ। और आपसे बात करेंगे डॉक्टर शम्सी कि आप बताइए हमारे व्यूअर्स को, what do you do?
I have been involved in the past with treatment of all kind of emotional disorders. But since 1980, I am treating drug addiction, mainly opiate addiction, which means heroin, pain pills, all those.
Okay. और do you think it has increased since 1976 जब शुरू किया था और अब 2014 के अंदर?
Actually, business has increased, but I think there has been slight increase in the use of drugs by younger people, but it looks like people have become more aware. Also in South Asian community now they have been more aware, so we are seeing more cases. In the past they won't bring their family members, now they are bringing.
Really? Another important question is, like, how can you tell if someone in your family or your friends is taking drugs? How can you tell that?
Yes, that's a very good question, especially for our viewers, that if we see any change in the behavior of the person which is abnormal, different from previous behavior, then we should know something is going wrong, either some emotional illness or the person is using drugs.
Right. And if they find out that someone is taking drugs and family friends, what should they do? Should they take them to a counselor, a psychiatrist, a psychologist? What should they do?
If they have some kind of insurance, private insurance they can afford, yes, it will be better to go to a psychiatrist who has certification from American Board of Addiction Medicine. Otherwise, I think the best thing will be to call if their local alcohol and drug abuse council.
Okay. All right. Well, definitely आपसे और बातचीत भी करेंगे हम, and we'll come to you now. And I know that you handle all sorts of things at your law firm. Now, for our viewers out there, what do you do and what does Prasla Law Firm exactly do?
The Prasla Law Firm specializes in business litigation and business transactions. We handle matters involving, employer-employee disputes. Also, if there is a individual or group who wants to set up a new business, they want to establish a new company, we help them establish that company. We help them draft the proper contracts they need to, put in place operating agreements. That way, if there are multiple partners, each partner knows what his or her role is, what his or her responsibilities are, and if there is ever an issue where they want to, be bought out or move away from the business, how that will be handled from the beginning. That way there are no issues later on or any disputes or bad feelings.
Okay. Now, let me ask you another question. A lot of South Asians, they go into business. Now, what is the first thing someone should do when they're thinking to go into a partnership with their family, their friends, or just two people?
My first suggestion would be whoever you're going to be doing the business with, sit down, talk to them, see how the business is going to be run. Because there are occasions where someone has the money, where they're going to be investing the money, but they're not going to be running the day-to-day operations of the business. That has to be laid out so everyone knows what their role is. And once you have that established, you get in touch with an attorney who can help you, create this business and get it registered with the state of Texas, and also create if it's a corporation, a shareholder agreement, or if it's a limited liability company, an operating agreement where you lay out, what the role is going to be for each partner, and how the business is going to run, who's going to do what, things like that.
So it's important to kind of going into partnership, make sure you have a contract. Now, what if someone has a partnership and they go into a dispute for whatever reason, especially in families and friends or just two people? What can they do? What are their options?
Well, if they already have a contract in place, and if the contract that they have in place covers that dispute, you can look to the contract to see how to resolve it. For example, if you have a business where there's two partners and one partner wants to be bought out, if there's already a procedure put out that if one partner wants to be bought out, how he or she can be bought out, then you can just look to the contract. The problem arises is when most of the time when you don't have these agreements in place, and at that point, it becomes, how do you resolve this issue, especially if one person wants to walk away or if one person is not happy with the way the business is run. That's where you have these issues, and typically the best resolution would be for both sides or whoever the parties are to work it out amongst themselves, because once the lawyers get involved, one lawyer can't represent all the parties. You have to have multiple lawyers which will have multiple views, and it ends up having, it causes a bigger problem. I mean, my suggestion would be always have the agreements in place first. If you don't, it just creates a much bigger issue, and the problems become much bigger and harder to resolve later on.
So get everything in contract before you even go, even if it's your own family member, even if it's anyone. Okay. Now, obviously we're talking about partnerships and, people going to business. Now, many South Asians, they work here in Houston or even other states, and they have a boss. Now, what if your boss does not pay you? What can a person do? What can an employee do? Do they have any rights?
Yes, there are several rights. I mean, depending on which state you work with, each state has their own laws. I mean, there are federal laws that apply across the country, but then there are also additional state laws. So depending on what state you're in, those laws would factor in. But typically, my suggestion would be first go talk to your employer. Typically, what happens is it could just be an honest mistake where they didn't issue you a check. But most of the problems that we see that employers and employees have with one another is overtime.
All right. Well, we'll talk to you more about this. And next, we'll move to you. Now, we're talking about Atrium Medical Hospital. Who are the people behind the establishment?
Atrium Medical Center is actually owned by 11 physician doctors. All the physicians felt the need in the community to have a long-term acute care hospital. What a long-term acute care hospital basically is that once a patient goes into the ER, from the ER they're transferred to either medical surgical floor, which is the regular floor, or intensive care unit, ICUs. Once their diagnosis has been done, once the treatment has been started, that's when they're transferred to a long-term acute care hospital for several needs. You can have IV antibiotic therapy needs, you can have ventilation management, wound care management, physical therapy, occupational therapy, so things of such nature.
And now for a lot of viewers, what is long-term acute care? Because people know hospital, they know these different things. Now, what is long-term acute care?
Long-term acute care hospitals are basically the hospitals where patients come to stay for an average of 21 to 23 days, approximately 3 to 4 weeks. And that's where you sort of get your rehabilitation done. If you are on therapies, you finish your therapies there. So basically this is a transition in between an acute care hospital and then your home or nursing home or whichever facility you came from. So it's a transition between patients who are not well enough to transfer to home from a hospital come to long-term acute care hospitals to become well to go home.
And another thing that's important, especially for our South Asians, is the language.
Right.
You know, it's a big concern, even the food and stuff. So what does Atrium Medical Center offer?
Atrium Medical Center is actually very accommodating to South Asian community. We're right in the middle of Stafford. So we're close to Sugar Land, we're close to Houston, we're close to all the major population, South Asian population areas. And besides that, we have halal food. If you are a patient and you've only observed halal diet all your life, so that becomes a concern.
It's a very big concern, of course. So they
we have
that.
a halal menu, and that can be requested. Besides that, we speak Urdu, we speak English, so that pretty much covers the South Asian language cluster.
Okay. Well, I think that's very important, like the halal food. A lot of people
Right.
have that in their diet. Now, a lot of people that are watching, they're watching in different states right now because TV1 is all across U.S., all across Canada.
Certainly.
So what if someone has to be transferred out? Is that something that they can do?
Certainly, we get patients from Hawaii. Last week I got a call from Hawaii, and they were looking for a long-term acute care facility, so we transferred them. So patients can get transferred, and it all depends. In the end of the day, it's the family's decision. Of course, there are several long-term acute care companies or hospitals in Houston and surrounding area. So it's all about the family choice. So if the family wants to come to Atrium Medical Center, that's what the case managers and the doctors will have to do.
All right. Well, thank you so much. और आप तीनों से we'll talk more right after the break. I've been told it's time to go on a break. तो break पे जाने से पहले आप लोग समझ गए होंगे कि सवाल पूछूंगी, जो कि एक गिव अवे भी होगा. सवाल आज का ये है, What was the age of Prophet Muhammad sallallahu alaihi wasallam when he married Hazrat Khatija? सवाल एक बार फिर मैं पूछ लूँ. What was the age of Prophet Muhammad sallallahu alaihi wasallam when he married Hazrat Khatija? यहाँ का नंबर आपको स्क्रीन पे भी नज़र आ रहा होगा. It is 855-886-6387 extension 4. और क्या जीतेंगे आप लोग, बता दूँ आप लोगों को. Barbecue Tonight की तरफ से you will win yourself a dinner for 4 and iftari. So call and you have more chances of winning. We'll be right back. कहीं मत जाइएगा.